tinnitus is something that's typically associated with hearing loss. It's something that actually almost everybody encounters at some point in their life, whether it be transient, where it comes and goes, or they have it on and they're noticing it all the time. However, the degree to which they experience it is what can vary from person to person. It's typically associated with hearing loss, and it's actually generated by the brain. So the sound is not coming from your ears directly, which is what a lot of people think. And which is why in some cases the sound itself could be centralized. And what's going on is the brain is no longer receiving the sensory input to the auditory system that it once did. And therefore it's kind of overreacting as a result. It's kind of reaching out to areas of the brain, trying to harness in this sound or look for other ways to bring it in. And it generates this noise. For some people, it's a ringing sound. Some people, it's a hissing, a white noise. It can sound like crickets chirping or cicadas. It can be a number of things. It can be a pulsating sound. But there are a number of ways to kind of manage it. It's not curable, at least at this point. And the best ways of managing it are actually, believe it or not, the first course of action, which in some cases the easiest, is hearing aids. Because hearing aids then give that auditory system back the sound that it's looking for, and then the brain gets that information, calms the brain down. Under those circumstances, it's not a permanent fix. If you take the hearing aids off for a period of time, the tinnitus will most likely return, but it can provide relief while you're wearing the hearing aids. The other most beneficial form of treatment has actually been cognitive behavioral therapy, which cognitive behavioral therapy is essentially trying to teach people to manage intrusive thoughts. Well, in this case, the intrusive thought would be the sound, the annoyance of the tinnitus itself, and getting you to not think about it and not focus on it. Because when you're not focusing on it, in many cases, it essentially doesn't exist. Now, tinnitus, it can be made worse by a few factors. Things like caffeine can make it worse. Stress is a big one. Stress can make it worse. Over-the-counter pain relievers such as aspirin, Tylenol, ibuprofen, those kinds of things can make it worse. And, caffeine can make it worse. So things like that could potentially impact it on a given day as to why it may fluctuate for some people. Someone may be very anxious about something that's going on in their life and notice that their tinnitus was particularly bad that day. So it is important to kind of understand it. Now, there's a lot we probably don't know about it yet, but, in terms of how we work towards a cure or in terms of management, but hearing aids, background noises, allowing yourself to be distracted from the tinnitus is often very helpful for people. Having sounds on in the background, if they're trying to fall asleep, you would want to have a steady sound, whether it be a white noise or a fan or something that has a repeating motion, but it's something that would be consistent. What you don't want is a television set on or something that's going to interact and as the sound fluctuates throughout the night, alerts your brain, it could potentially disrupt your sleep cycles. So in terms of tinnitus and how we could potentially help as audiologists is diagnosing hearing loss, being able to provide them with amplification to treat with that, and also just providing with information about tinnitus and how to try not to focus on it in utilizing background noises. And in many cases, that's very helpful for patients. So if someone is out there and they're experiencing that, it's something we can absolutely discuss with them and perhaps come up with a course of action and treatment plan that may provide some relief from the tinnitus. And we can absolutely try and do that for you here at Jacksonville Speech and Hearing Center.